first podcast, we are meeting Dr. K.A.Reddy from Hyderabad, very well known for Zygoma implant specialist. Zygoma implant surgeries, he is doing a lot of surgeries and he is known for his courses and lectures. And we welcome for our first podcast. And I want to know how you changed from the regular implant practice into Zygoma. What motivated you to start Zygoma, whether it is a desire or any need?
Thank you for inviting me for your first podcast, Dr. Murugavel. Okay. And Dr. Murugavel himself is such a big implantologist, and I feel very privileged to be here in his clinic, and I really pleasure this moment, and I'll remember it for a long time. And okay, so since you have asked how I moved from implants to zygomatic implants, I'm always on the a constant run to do something different from what I am doing. So I never get settled for less. So initially I started from I did my BDS and MDS from GDC Hyderabad. I started off doing root canal treatments. Then somewhere I had a passion for surgery side, endodontic surgeries. So here root canal treatments, I was getting bored. It was like a monotonous treatment and there is no surprises. Every case is almost like a routine case. So most of the times we felt like we are just working for money. There is nothing, no new or new change is there in life. So somewhere and one doctor has motivated me. Dr. Baiju Gopalan Nair asked me since you have a very good surgical skills, why don't you move to implants, he said. Then I said the place where I practice are all middle class patients. They cannot afford implants. Though he said only one thing. Said when you can do root canal with bridge for 12 to 15,000, same cost you can do one implant. So I took his advice and then went to Kerala, Alapi, and then learned implants. Then I was doing some implants, then I got stuck with some cases where I want to do something different. Then I have been advised to go to Pune again with Dr. Nanda. Dr. Nanda. Then after coming back from there, I started doing regular implants as well as BOI implants. Okay. After doing this regular full mouth rehabilitations, then we had a patient who required zygomatic implants. Okay. So here there is a small change has happened in my life, that when I wanted to do a zygomatic implants that time, but I didn't know how to do zygomatic implants. This I am talking about 2016 August. Okay. August 2016. The date I clearly remember. During that time, only 2 surgeons in India were doing zygomatic implants. Okay. So I don't want to name them. So I asked them, sir, can you please teach me how to do a zygomatic implants? Then they somehow, I don't know whether they were ready or what problems they had in teaching me. One doctor said you have to be an oral surgeon, oral maxillofacial surgeon, okay. And you have to be oral maxillofacial surgeon. And since you are an endodontist, you are not an oral maxillofacial surgeon, so you have no idea about how things works in general anesthesia. Okay. And I do it under general anesthesia, so and I'll train only oral maxillofacial surgeons. But I was when somebody says you cannot do it or I can't teach you, then the passion increases further. That if somebody is denying me, I don't keep quiet. Let us also see how I cannot do it. Let me try and see how, from where I can learn and do it. Then I asked one more doctor in North India. Okay. Even I don't want to name him. So I asked him, doctor, can you teach me zygomatic implants? Means he's a very nice person and a very nice human being. But I don't know what were the reasons, but it could not materialize. To the extent he said, doctor, I have a patient coming in next month. I have to do a zygomatic implants for him, so I have to learn before that. I want to understand the anatomy, techniques, everything. So I want to do it properly because I am doing it on a patient. Then he said, no, we need 5 doctors to conduct a course.
Okay.
So I can arrange a case, but arranging 5 doctors I'm talking about 2016, it was not that easy. Now here every month, every 15 days, one course is happening. Not one course, several courses happening in several states. But in 2016, there were not many courses, hardly any courses, and nobody was teaching zygomatic implants at all. So he said, I cannot pull that 5 participants, he said. Frankly speaking, I offered to pay 5 participants money.
Okay.
I told him, sir, you don't search for 5 participants. All that 5 participants money, I'll pay for you.
Okay.
And I'll come alone. You arrange a case, I'll then pay it for you. So don't worry about participants. Then he said, okay, I'll arrange, but somehow that did not happen.
Okay.
Then, I felt like I'm being ignored. Somehow, some people don't want me to grow. Then had a huge burning desire to do somehow, I have to do a zygomatic implants now. It is like a main life motto that I have to do a zygomatic implant. Then, but we have to be honest with the patient that we have to do good work for the patient. Then suddenly I realized like what could be the best options, and I had to look for a YouTube video.
Okay.
Then I saw some YouTube videos, they were very interesting. So after finishing my practice at 9 o'clock in the evening, then I skip my dinner every day, so that if you have dinner, then you get to sleep. So after coming back from clinic, I sat in front of the YouTube.
Okay.
Then I used to note down which one is doing who is doing zygomatic implants. Most of them were Italian doctors, American doctors, European doctors. Most of them were European doctors. Dr. Igal Balan was there. So then I looked at few of them. I note down who is doing zygomatic implants and how this doctor is doing the zygomatic implants. I noted down some points on how this doctor is doing. So I noted down his name so that I can watch more videos of him next time, because otherwise you'll forget those names. So then I watched almost like around 150 to 200 videos.
Okay.
For a period of 10 days, only zygomatic implants. Zygomatic single, double, triple. Though I was intent to do only single, but I also wanted to see the double and triple, so that we get a thorough understanding of how they are doing, where they are, how they are entering into the zygomatic bone, what exactly is zygomatic bone, any important vital structures, any blood vessels, nerves, everything. Then I started using the Google images, Wikipedia and all. Then now I have a theoretical knowledge. Videos, I have seen so many videos, but I have to implement this practically. So I cannot, being an endodontist, and I never opened this particular area. So, and it's being a zygomatic implant is a long implant. So I was little concerned about patient's health. Then I said, like, before trying it on a patient, we should do some practice. So that time this STL models were not there. This mock surgery is what now the young generation is doing, mock surgeries. Yes. That time STL models were not there. Immediately one idea struck to me that I should practice on a skull. And that time this cadaver courses were also not there. And nobody was conducting cadaver courses. And never had an idea that I should go and do it on dead bodies. So only thing what it struck me is, then we will go to my own college in GDC Hyderabad. Okay. So there I met anatomic department assistant. Okay. He was, the department was not willing to share a skull with me, because they never wanted somebody to take the skull outside the college. But somehow, we managed, managed assistant that I will not throw anywhere, because it is a medical legal problem. If I throw the skull outside, it becomes a legal problem. Then I promised him that I'll keep it with me in my clinic only. I just want to use it for my own surgical training purpose. Then somehow I could convince him. I took the skull. Then I used to keep the YouTube video like this. Okay. And you play for 1 minute and then pause it, and then the same procedure I used to repeat it on the skull. Okay. And he was doing it on a patient. Here also I kept it like a patient only, like it's not like you turn it in different directions, you can easily do it. Yes, yes. So the way he was keeping the patient, same thing I was doing at a skull. Okay. Same, I simulated it, everything I simulated it, so that I want to have a real experience. Otherwise, I'm doing it easily on the skull, tomorrow suddenly when patient I open, then I'm getting panicked. Okay. So everything I replicated it on I was watching YouTube and then replicating on a skull. Then I did my first, when patient had come, then I did my first zygomatic implant on that patient, and successfully we could finish in less than 10-15 minutes.
Yes, okay.
I was like, frankly speaking, I felt like, even my wife said, it is a pure fluke. What we say pure fluke means it is a sheer luck that, you just drilled and then implant went inside, and that was a cortico-based implant, not the conventional implant.
Okay.
Because in a cortico-based implant, I had to bend the implant. Without bending, no. So only unless you torque it well, you cannot bend it. If it implant is loose somewhere, hanging somewhere else, you cannot bend it. So I could bend it also. Implant I bend it. That means it is in a right place. But honestly speaking, what knowledge I have today, I didn't have even 5 to 10% of that knowledge in 2016.
Okay.
So somehow I dared to do this, but at the same time I was conscious about the complications. I was carefully trying to do it well. Fortunately, I did well. Okay. Then after this, after operating this patient, 1 week after operating this patient, I saw a brochure on Facebook or some social media. I don't exactly remember that Noris Implant is conducting a course in Mumbai with Dr. Raghav Verma from Himachal Pradesh. So this Dr. Raghav Verma, you can edit actually. Okay. So Noris was conducting a course in Mumbai. So when the Noris had conducted the course, I messaged doctor saying, doctor, if you don't mind, this is my photographs of my zygomatic implant, which is done just a week back, and I have restored also. Okay. Patient is doing fine, no complications. If I attend your course, will it be helpful? Then he said, no doctor, you need not, because you have done it very well. I have seen the photographs. You have done it very well. You need not come for the course. Then, but I said like, no, let us learn it more better and let us see how you are operating, how he is operating. So I want to see how other are solving. Course fees was not a problem. So I went to Mumbai. Then a few weeks afterwards, then I tried one more case in my own clinic. Then I could do it very easily. Okay. Then, frankly speaking, what we are talking about, Zaga 1, Zaga 2, Zaga 3 concepts, even those concepts I don't know. But only thing is, I was observing this maxillary plane to the zygomatic plane. So if it is flatter, how I should go deep inside, how it is, if it is raised, how I should go inside. That much I could observe from a YouTube that based on that differences, this is one. But I didn't know that it is nothing but a Zaga concept. Afterwards, when I started reading what is Zaga concept, it is nothing but what is my own observations. It is my own observations, is nothing but my Zaga concept. That's when I realized, okay, wonderful, beautiful. Then I started doing slowly zygomatic implants, and whichever patient has a very less bone, I started doing zygomatic implants. Then when we start doing, obviously we'll start getting more and more tougher cases. People also started referring cases to me that, you are doing zygomatic implants. Can you do this zygomatic implant? More and more complicated cases, rejected cases were coming to me. Then slowly, when there is absolutely no bone, then we started doing zygomatic implants, double zygomatic implants, quad zygomatic implants. I just started doing. In the meanwhile, COVID has come. And because of this COVID, a lot of black fungus, mucormycosis cases had come. So anyhow, we gained a lot of knowledge in this zygomatic implant. By that time only, I must have done almost 350 surgeries by the time we started doing COVID mucormycosis cases.
Can I interrupt?
Sure.
You told at the time you were doing 300 zygomas.
Yes.
Because I went for a zygoma course. During the course, the trainer told, till now he has done 25 zygomas. Then I was surprised. So after finishing 25 zygomas, people are conducting courses.
No, I didn't conduct course when I was in that stage. So we started 2020, after COVID only, we started conducting courses. Then we started, luckily, fortunately, we also started a Mucor Care Foundation. Me and Dr. Swapnil and Dr. Ranganath. Three of us thought like we'll help this, because most of the mucormycosis patients were poor patients, economically poorly driven patients. So we thought we could help these patients by doing quad zygomatic implants. We charged very, very less and then tried to help those patients.
So you told about your first zygoma experience. So at the moment, how you felt yourself, the heartbeat rushing? Is it
no, now it is like, I don't feel anything. It is just as normal. First experience was a very thrilling experience, a very, because there was no one around me to guide me. There is no, it's not a one-on-one shadow course. I was doing all alone, and my staff, my wife, nobody knows, has no idea about how the zygomatic implant is done. And when I held that long drill in my handpiece, it was like, it was like wobbling actually. It was like, shaking, because it's a long drill. It's not that easy to control when you're doing it the first time.
Okay.
Now there are a lot of courses are being conducted. Now a lot of people are conducting shadow courses. So it is far easier now. But in 2016 it was very, very tough.
Without mentor, without guide.
Without mentor. And only thing what I really love about myself is like I learned these things long back, thinking that future whenever any patient who does not have any bone at all, obviously will be in a lot of demand, because there are very few zygomatic implant surgeons. So I thought like in future we could get a very good chance of doing a lot of rehabilitating atrophic maxillas. Now just because of COVID, because of this mucor case, everybody wants to learn zygomatic implants now. Now their age is almost 50-55 years. Now at this stage they want to learn. So this we fortunately we have foreseen all these things and started doing long back. So that is one good thing we have done.
When you are talking about, you went to anatomy department and got skull.
Yes.
Similar story I have heard here also. In Madras Medical College in MMC, there is one professor called Rangabhashyam.
Okay.
So he is the creator of gastroenterology field in Tamil Nadu.
Okay.
He is the first one to introduce many kind of a special department for gastroenterology happened because of. So if next day if some surgery, a unique surgery is there, what he will do is he will go to anatomy department and get a cadaver and he will operate that surgery. Then next day he will come and do. So the same kind of story I am. And also I want to share one study they did with monkeys. They want to study about the brain activity. What happens when the brain activity when the monkey is eating banana. Okay, so they were attaching all the things and they are giving a banana to the monkey.
Okay.
Group of monkeys. And some group of monkeys are observing they are for some study, but they are just seeing what is happening. They are studying the brain activity. But surprisingly what happens is the scientists found that the monkeys who are observing these monkeys, the same brain activity is happening there also.
Oh, wonderful.
Because they are actively seeing
them.
And with the intention that I also want to eat that banana. So the same brain where that monkey is activated, the observing monkey is also activated.
Okay.
Later they named it as a brain mirroring phenomena. So when we watch with full focus and observation, the same areas which the surgeon is activating in his brain, it is activated for us also. Since you have watched those videos and tried with good intention, intense intention, the same brain activity which has happened for Balan, Eagle Balan, it might have activated for you also. That is why